You're watching continuing coverage of the World Healthcare Congress 2012 in Washington, D.C. I'm very pleased to welcome Vishal Bali, who is CEO of Fortis, to the studio today. And Vishal, you have a lot of experience working in 10 different countries in the healthcare market.
Right.
How would you compare what you're seeing in some of those markets to what we're trying to do in the United States?
So I guess, when you look at our portfolio of geographies, so we are in some developing countries, India, Sri Lanka, Vietnam. Then we are in some developed countries like Singapore, Hong Kong, Australia, New Zealand. And then, we also have presence in the Middle East and Dubai. So basically, when you compare the healthcare systems of the Eastern world to the healthcare systems of the Western world,
yes,
one of the key differentiating factors is that the United States of America is spending 17%, 16% of its GDP on healthcare,
yes,
whereas the Eastern economies are probably spending 5 to 7% of their GDP on healthcare.
Wow, what a difference.
And that's a huge difference. So fundamentally, one of the big changes that one is seeing is the affordability of healthcare in the Eastern economies or in the eastern part of the world, and particularly in Asia Pacific, where we have our dominant presence with 74 hospitals. We are finding that the cost of care and the quality of care, and merging both of them together towards affordability, is becoming a very important part of the activity that we are doing. And secondly, I think over the last many years, the quality of healthcare, which was a huge differentiator between the hospitals in the West,
yes,
and the hospitals in the East, has sort of disappeared. Because most of our hospitals now in countries like India are Joint Commission internationally accredited, which is the same Joint Commission that you have over here.
Right.
So I think it's becoming a level playing field as far as quality of care is concerned, but the cost of care is a huge there is a huge gap.
Yes.
And I think that needs to be corrected in more ways than one, for the United States citizens to be able to get more affordable care in the U.S.
Now, and you also work within 10 different countries and can make a very good comparison between those countries as well. Are there some much more efficient and much more able to handle the demand?
Yeah, so one of the things that we are seeing changing is many of these countries, like Vietnam, are social healthcare countries, even Hong Kong. The government is responsible for healthcare in these countries. And then we have Singapore, where the government plays a very important part of healthcare delivery, but allows the private sector to compete with it. So probably in the Asia Pacific context, Singapore is the only country where the private healthcare providers and the government institutions literally compete with each other for clinical talent and for the same patient group.
I see.
So what we are finding is within Asia itself, a lot is beginning to change. So you have countries like India, which have a population of more than 1 billion people, and healthcare needs to be provided to those billion people. And then you have countries like Hong Kong, which are very closer to China, and then there are the mainland Chinese patients who are coming and getting treated in Hong Kong, and the Hong Kong government is not able to cope with the pressure that is there. So all of a sudden you are finding a lot of healthcare development which is taking place in Asia.
Yes.
And fundamentally, Asia is the world's fastest growing healthcare delivery market.
Right. I mean, well, how do they handle questions like bundling of care or pricing of care? Because those are topics that we are trying to grapple with right now.
Yeah. So we've been, like in countries like India and some of the other countries around the region in Asia, the bundling or the packaging of products or services has been going on for the last many years. And the reason being that when you have 80% of the population paying out of pocket, they need a certain certainty of their cost of care, right? And so in all these countries, there is bundling of procedures which has already happened. So what the US is grappling with has already happened in many of the Asian countries. So when you enter into a hospital in many of these Asian countries and you say, I need to go through a coronary bypass surgery, they will give you a bundled cost, which is an all-inclusive cost. So you don't have 20 different billing procedures coming at you from different, from the doctors, from the hospital, from diagnostics, and complicating your life in terms of not knowing what is your end cost of care. But in Asia, you always get an endpoint cost of care, which may be 10% less or 10% more, and people are able to live with that certainty. So I think that is a lesson that needs to be learned in terms of how many of the Asian hospitals are able to provide endpoint price point around bundled care.
You've brought up a couple of very important points, the leveling of the playing field in this area, and also just the ability to have some of this homework already done that, that we're working on here in the United States. What are some of the negatives and the pressures that will come up, though, for countries in Asia? You have a very close bird's-eye look of that. What are your thoughts and some concerns that you might have going forward there?
So Asia is, Asia is heating up in terms of, the kind of economic activity that's happening in Asia. All the countries in Asia are fundamentally growing between 6% to 8% annually. So that effectively means that there is a lot of change which is happening within the Asian economies and within all these countries in Asia. What could go wrong is the pace of development of healthcare delivery systems is very high right now. And we may not, over a period of time, have the complete manpower bandwidth to sort of take on this mammoth growth which is happening in the healthcare delivery systems there. So I think our biggest concern today, in Asia, is the fact that we don't have enough healthcare talent, both on the medical side and on the paramedical side, to cope with this rapid pace of growth. And that's the big concern, because the other big concern which used to be in the past of quality has been corrected. But I think the big concern is going to be that, with these multiple hospitals coming up in different countries, with diagnostics increasing, we will need a lot more clinical and paraclinical manpower, which will need to take care of this growing demand. Which
could provide a lot of opportunities for companies looking for them.
Absolutely.
Okay, very good. Thank you very much for your insight.
Pleasure,
Appreciate
Mabel.
your time.
Pleasure. Thank you very much.
I'm Mabel Jung. Thanks for watching.